Namaste dosto, welcome back to my channel. Year 2025 is about to over and we are entering into year 2026. We know that the year 2026 will be seeing much more vibrant in respect to artificial intelligence. We are seeing the gross change happening already, and the year next and afterwards will be seeing a lot of changes in the era of artificial intelligence. And this change will have greater implications on the patient's behavior as well. Today, we are already seeing patients coming with reference to the artificial intelligence. They come to us with what they have read in artificial intelligence. They do upload the prescriptions and talk and discuss with us what the side effects are, what the pros and cons of the treatment. We are already seeing that. But we doctors are still somewhat not using artificial intelligence as like the patients are doing it. Probably there is some kind of a gap that we are already feeling it in our day-to-day practice. This gap can cause problems in future. We doctors should also understand when patients are going for artificial intelligence to find the answers, definitely there could be some medico-legal issues coming up in the future if not properly validated. In the past, patient used to Google their symptoms and come and ask us some doubts. And the doubts could be easily managed and we could convince them, as the most of the doubts or the whatever questions they asked, they were not in the fitting into the context. But with artificial intelligence, which is a more contextual, which can take a lot of the context and give the answer, many a times it does give near accurate answer. Of course, I do agree there are some mistakes when they refer, but a learned patient can definitely search his illness properly and come to some sort of a sensible conclusion. He can come up to that. So we should also be very careful when the patients are searching our prescriptions, searching our diagnostic reports and coming to us with the clarification. If we dismiss something and if that leads to some complication, then we may be facing medico-legal complications. This will be the new thing that is going to happen, and we doctors should get ready for that. And to quote one simple example, couple of days, one of my patients who had undergone angioplasty about 6 months back, he was overweight, and he came to me and he said, "Sir, I want to reduce my weight." Then I said, "You definitely have to go for a exercise diet, and that's how you can reduce that. The best way to reduce our weight." "No, sir, I need to reduce it in 6 to 8 months because I'm due for knee surgeries." "Okay, then I will refer to endocrinologist. He may try the newer GLP-1 GLP-1 drugs, that is Ozempic or something like that." The patient immediately asked me, "Sir, can it cause thyroid carcinoma?" I was wondering how patients know so detail about the drugs. So the patients are now more educated about their illness. They know the pros and cons of the illness. They know the pros and cons of every medicine, every prescription, every intervention, every surgery we are doing. Because henceforth, what we thought, the medical knowledge, we doctors are not alone the custodians. Now the knowledge is liberal or freely available across the internet for anybody. Anybody can refer any internet journal and come to know the diagnosis, make some sensible conclusion. It is possible these days, even for a non-medical. If he is bit having a STEM in his education, then it becomes much easy for him. So we should be very careful henceforth. We cannot afford to say get away with the easy prescriptions. Further, one more important aspect I want to stress here is that these patients' behavior leading to medico-legal complications. If we have to protect ourselves, we need to document what all we do properly. Our age-old method of documenting, like within the paper, half-written notes, not complete, can get us into trouble. Because if you are not documented and if you are not told the patient, if you also not use artificial intelligence in your practice, because document to the extent what I'm telling does require artificial intelligence for you in your practice, in your electronic medical record. With that advantage or with that weapon in your hand, if you do practice, chances of you getting medical legally sued will be less. So the year 2026 and beyond, we will see graphs of change in patients' behavior. Patients will not be like before. And for the fear is not the diagnosis you do, not the treatment you give. The actual fear will be mobile phone of the patient, which he can upload your prescription, check what all is there and not. That's how we can litigate you in case if things are not going well. So we need to understand that we need to communicate more with the patient even after the patient has gone home, because there could be some sort of a channel should be left open between you and the patient even after the patient has gone home. Maybe that we can deploy voice agents for your clinic where the patients can communicate in the voice, so the appointment are possible, or somebody should be able to talk to them back, so the patients feel some sort of a comfort that in case something goes wrong, the doctor is there to take care. We need to be available more. Of course, physically it is not possible, at least by creating a twin, digital twin, or by digital twin could be down the line, not no next year, or in deploying a voice agent for your healthcare will also add to some sort of a patient's confidence that this clinic or this hospital is there if things go wrong. These technologies we need to implement in our practice henceforth. These days are not far. Already in the developed countries, they do have the communication link back, because if the patients go home, the patients can put the questions and the doctors with the help of the artificial intelligence can report them, what they call as a paisama time. There some sort of an thing we also got to do it, because it can cause some sort of an medical legal issues, because if the patient approaches some lawyer and he drives them towards the court and you are not in easily available for talking, then you may have problems. So you stay connected with your patients, that can also protect you. And when you treat the patients, show the empathy. That's the most important thing now, because if you don't show empathy with them, if you're rash with them, then the doubt and the whatever little mistakes what patient feels can get exaggerated, and you may end up in the uh, legal battle. Of course, in the legal battle you may lose or win, but battle itself is a horrible thing, we all know that. So I would suggest in coming 2026, the changing patient behavior, we need to be more concerned and more, what you say, more vigilant, and keep our records very clear and clean. Definitely, we need to go for electronic medical records like our own nice HMS, which is artificial intelligence powered, and we need to have whatever the Indian government NHA has recommended, Ayushman Bharat Digital Mission, that linking of the records. These things we should start practicing, or else maybe down the line we may face some kind of a medical legal threat. That's all for today. Thank you. If you have got any comments or anything opinion, please do put in the comment box. Hmm? Good day. Good day.